Health anxiety and chest pain. This is new for me actually, because my health anxiety has always been based around cancer specifically, and things like sepsis and infections and neurological diseases. I've never really worried about my heart. However, for the last 3 weeks I have started getting chest pain. And it's been scaring the crap out of me because it's not something that it's not one of my typical anxiety symptoms. So it kind of I was getting like this sharp stabbing pain, and it was mostly in the left area of my chest. So obviously, if you Google that, it's going to tell you you're having a heart attack. And the more I thought about it, and the more I was getting worked up, I actually started to get pain down my left arm. I was getting pain all around my shoulders. I started to feel lightheaded, which are all heart attack symptoms. I'm 26, I'm healthy, I don't smoke. If anything, I'm underweight, I'm not overweight. So yeah, I am pretty certain that there's nothing wrong with my heart. I also had an ECG done when I was pregnant because I was stressing out and I wanted to check my heart, and that come back fine. So I'm pretty sure if there was something wrong with my heart, the ECG would have picked it up. So I'm pretty sure that it's anxiety, and it's scary. When you feel chest pain, and anxiety chest pain can be bad. I was having shooting, stabbing feelings in my chest. And the more I thought about it and the more I focused on it, I become sort of hypersensitive to any twinge in my body. And I think the following week then, after I started having the chest pain, I was just getting pain all over my body. I was just having these shooting pains just all over my muscles. My joints have been hurting. And I know that this is because when I get into this state where my health anxiety is really, really bad, any little twinge in my body I will focus on, and it just seems so much worse. I did this about a year ago. I convinced myself that I had ovarian cancer, and I read that a symptom of ovarian cancer can be pain down your left leg. And I had pain down my left leg. I had real excruciating pain down my left leg, to the point where I got Joe to call an ambulance because I was in agony. And they came over to see me, the ambulance, and they were so patient with me, and they were like, there's nothing wrong with you, but we'll take you to the hospital if you want some reassurance. And I did, and they didn't find anything wrong with me. I was absolutely fine, but I really did feel that pain. I actually felt it. I didn't imagine it. My body actually produced that pain. And this is something that can happen with anxiety, and especially health anxiety, is we become so hypersensitive and so hyper aware of everything on our body, and we can convince ourselves so much that, say for example, you are convinced you have a heart attack. Without you knowing it, you are tensing your left arm, because if you know that a symptom of a heart attack is that you'll get pain in your left arm, you're sending all of your energy to that left arm. And what happens when we tense up? We get pain. So you are actually feeling that pain, but 9 times out of 10, it's not going to be because you're having a heart attack or because you've got ovarian cancer. It's going to be because you've stressed out so much and you're so focused on that area of your body that you've actually manifested the pain. And this is the danger with health anxiety. It's you get stuck in this rut and you're is this real pain, or have I brought this on myself? It is scary. It's scary because people with health anxiety, we can't rationalise sometimes, and we can't be logical, and it's hard to know, what is an actual life-threatening pain and what is anxiety. And I will always say to anybody who has health anxiety, go to the doctor, get checked out, get your reassurance, because at the end of the day, I would hate to tell somebody that it's just all anxiety, and it is actually something that needs some medical attention. So what I do to reassure myself is, if I have any new symptoms or I'm worried about something, and even if I'm 95% sure that it's anxiety, I will still go to the doctor and get my checks so that I know that I've been checked over, I've reassured myself, and I can, well, not relax, but I can kind of dig myself out of the hole a little bit, because I know that it's my anxiety that's doing it. But chest pain and anxiety is a real thing. It hurts, it's painful, it's scary, you feel like you're dying, you feel like you're having a heart attack. But like I said, you know, if you're like me and you're in your 20s and you're healthy, it's unlikely to be your heart, you know, especially if you know you don't have any heart defects or there's nothing wrong with your heart. The chances of that happening is very, very slim. So if you are somebody who deals with chest pain and you're concerned about it, like I said, I would just go and get checked out, go and get your ECG, go and get your blood tests and get that reassurance. But if you do want to speak to somebody who goes through this as well, please, please, please shoot me a message. I will talk to anybody, and I would hate for somebody to feel like they don't have anyone to talk to and, you know, they're feeling worse. So shoot me a message, give this video a thumbs up. I really want to get this channel running. I really want to make this into a thing where, you know, people can watch my videos and kind of take comfort in the fact that, you know, I'm somebody who experiences it well, and you know, it's normal, and anxiety is a bitch. So yeah, and subscribe if you want to see more of these kind of videos. I will be filming more over the next couple of days because I've got some time off, so I thought I'll just sort of bang them all out. And yeah, I will see you next time. Bye.